Hi YouTube, I am back. I made it back for another video. Okay, it's Foxy Chick EC. Welcome to my channel. Thank you for coming to watch this video, I guess. And thanks to everybody that watched the last one. A lot of people left a lot of really sweet comments and sent me a lot of messages with questions that I tried my best to answer, and just it seemed like it was very helpful for a lot of people. So thank you for watching, and I'm glad I could help in some way, I guess. Okay, so for people who maybe this is the first video of mine that you're watching, obviously you clicked on the title to get here, so you know that I'm a PA student. I am a PA student. I'm in Indiana, and I just finished the fall semester, which was my second semester in PA school, and we are now in our spring semester, which is the third semester. And we actually just interviewed and admitted the next PA class, which is insane to me because I'm like, I just started here and now we have another class, but hey. So I'm in my third semester. I'm in Indiana. I am a PA student. If you want to get all the information on how I got in and all that stuff, it's very detailed in the previous video to this one. Just go to my channel and you'll find it. Okay, so this video is going to be talking about my experiences in the semester that we just concluded, the fall semester. Okay, so let's get started. The curriculum for the fall was 18 credit hours total. We had pharmacology, which is 3 credit hours, patient evaluation, which was 3 credit hours as well, pathophysiology, which was 4 credit hours, and then clinical medicine, which was clinical medicine was 8 credit hours. So for a total of 8 plus 4 plus 3 plus 3, 18. So in clinical medicine, we had modules. So clinical medicine was one subject with 6 modules. It's infectious disease, dermatology, genetics, hematology, and oncology were combined together as one module, and then radiology was a module by itself. In the spring, just as an aside, we're only taking patient evaluation and clinical medicine, that's it. But clinical medicine now has 9 modules. It's popping off, and it's popping off heavy. We've got 9 modules, which are EKG, ENT, neuro, respiratory or pulmonology, nephrology, urology, rheumatology, endocrinology, GI, and cardiology. And that's what we're doing this spring. And the Lord himself will help me get through it. Okay, but that's just an aside. All right, so focusing more on the fall, those were the subjects that we took. Those were the number of credit hours. Those are the modules. So comparing to the summer semester, the fall semester was a lot more work. When we got into PA school, our senior class, the class that's going to be graduating this year, 2018, when we started, because we had one class that we took together, the health promotions class, they were like, oh, you guys will be fine. I mean, this is not really the first semester of PA school. The fall semester is the first real semester of PA school. And I was like, how rude. First of all, I'm working very hard on anatomy and physiology and intro to PA profession. How dare you say we haven't started the work yet? You guys were right. We didn't know anything about what was coming. This fall semester was rough. And I'm not just, I mean, obviously I'm talking about me because I can only speak from my own opinion 100%, but my classmates as well, at least the times that we spoke and everything, and the times that we communed and everyone shared, people struggled. This fall semester was rough. It was boom, boom, boom. It was no breaks. It was, you couldn't catch your breath. It was constant. And then when it was done, it was just like, oh my gosh. The fall semester is really rough. So if you're getting into PA school and there's a first semester that gives you your anatomy and stuff, and then there's another semester after that, the one after that will probably be the one that will hit you hard. So just my experience, just letting you guys know. Okay, so how the classes were broken down and how we learned them. Let's start off with our, how did I organize this? Okay, pharmacology, because that's the big one. I know a lot of people are like, pharmacology, all of these drugs, Pharmacology was not that bad. The way that we had it, we had pharmacology Mondays, Wednesdays, and Fridays for 1 hour at a time. Every drug, almost every drug, was lectured by a different guest lecturer. That was like, it was like their specialty. Like toxicology, we had an ER doc that sees all the people that come in that are poisoned. Antivirals, antibiotics, we had a different guy. Antipsychotics was a different person. Anti-epileptics was a different person. But we had one course coordinator, and she was the dean. She's one of the deans of School of Medicine at my school, and she was always there, and she's the one that you would email and be like, this is not clear, that's not clear, because she knew her stuff. She taught us about half of the lectures, and the other half were taught by the guest lecturers. So total, I want to say we covered maybe 300 and something odd drugs as far as drugs that we had to know specifically. It was tough, but because it is such a dense course, it was very well organized at my school, and I give them credit for that. We had a quiz every week, so every Friday, the Friday class would start with a quiz. So it kind of made you have to study every week, because bums like me don't. People like me procrastinate. And when you procrastinate, you wait until like 3 days before the exam and you start cramming, and then you make it and you're like, whew, and then you do it over and over again. This course didn't let you do that because every Friday there was a quiz. So the lecture material from Monday and Wednesday, you'd be quizzed on Friday, in the first week anyway. And then the next Friday, the lecture material from Friday, Monday, and Wednesday, you'd be quizzed on that Friday. So you were constantly keeping up with the material. So it wasn't too bad. It was still dense, but it wasn't too bad. You have to recognize the drugs. We only did generics. We didn't really do brand names because there's different brand names for the same drug. So it would kind of be, it's kind of tough though, because sometimes you'll see a drug and you're like, what is that? And then tell you generic, you're like, oh, I know what that is. Like ibuprofen versus Advil versus your Tylenol versus your naproxen versus Aleve. So some of these things are actually the same thing. I know what I'm talking about. I know I sound stupid because I just named all different drugs, but I know what I'm talking about. Anyway, so recognizing generic names, they just kept it standard. No need to learn brand names. And then Sketchy Farm. A lot of people use Sketchy Farm. I had access to it. There was just not enough time to watch the videos, man. Like, the videos were cool. I used it mainly for the antibiotics section, and it helped me remember salmonella and like the red flowers for the fluoroquinolones and all that stuff. But I didn't have time to sit down and watch these videos over and over. But the one video I did watch, I don't think I'll ever forget. It just sticks in your head. So if you don't know what Sketchy Farm is, it's a service that you pay for, and it has videos and tons of mnemonics and drawings that they draw on the video as you're watching it for you to remember characteristics of certain drugs. And the other thing was that the drugs that we were covering weren't always all the same ones that we're talking about in Sketchy Farm. So I was like, I watched it once, didn't really use it, but it did help the one time I watched it. The final was comprehensive for pharmacology, which I was like, oh my gosh. But then the final wasn't that bad because it was like very basic questions. Like, if you've taken this entire course, you should be able to answer these questions, and it was fine. The final was fine. Pharmacology as a whole really wasn't that bad. It did take work. You could not fake the funk. You had to study every week to keep up with the quiz and then went the final, but I did pretty well in pharmacology. Patient evaluation. So this is a course where you examine the patient. This is where you learn how to use the otoscope in the ear and the ophthalmoscope in the eye, and how to palpate the lymph nodes, and how to press the abdomen, and how to listen for chest sounds, rales, bronchi, crackles, wheezing, stridor, all that stuff. This is the class that you do that. So we started that. This is the class where you learn how to have bedside manner. This is a class where they teach you to make sure you sanitize your hands each time with the patient. This is the class where they teach you to tell the patient what you're going to do before you do it. This is the class where they teach you techniques and things that you'll notice clinically before the patient even tells you anything that can lead you in the direction of a right diagnosis. So this is a class really that you learn how to do medicine, you know what I mean? And then based on what you learn in this class, you'll then know what to order as far as lab and other diagnostic testing. But this is a class that makes you a clinician. So I enjoyed it. This is a class that we used our medical equipment too, so that was kind of fun. We had OSCEs, which some of you know what OSCEs are. It's kind of like you get a fake patient, a fake standardized patient that has a story, and you have to conduct a core exam of some kind, or they give you some instruction on what to do on the patient. They don't want us to just do it on each other like we do in our lab quizzes, because you giggle and you don't take it seriously. But when it's a real fake patient, then the way your nerves would be in an exam room is how they would be with this fake patient. So our OSCEs, Objective Skill Clinical Examination, I believe it stands for. And those patients give you good feedback, because one of my patients said, I talk too fast, and I do. But my classmates wouldn't have said that because they hear me talking every day and they're used to it. So she was like, she talked really fast, I couldn't understand what she was saying. So I learned to have to slow down when I'm talking to my patients. With the OSCEs, it helps because you then have to remember exactly what to do, what components of an exam in order. And it forces you to have to learn it. And the best way to learn it is to practice it over and over on your family and friends and your classmates, and then you come for the OSCE and you do well in it. So patient evaluation is the class that teaches you how to be a good clinician, and I enjoyed that class too. It wasn't too bad. Let's see, pathophysiology. I hated pathophysiology in the fall. It was the bane of my existence. I didn't like it. There's a ton of cell signaling, a ton of minutiae. Yeah, you can make fun of me. I probably pronounced that wrong. A ton of very, very small details that we were being forced to learn and tested on. It was very random. I was struggling in this course. I did pass at the end of the day. It was a B, actually, but man, that course taxed me. All of the things that I've been avoiding as far as prereqs, immunology, cell biology, some embryology was thrown in there for good measure. All of that we got in pathophys in heavy doses. And I know that a fair number of my classmates also struggled, but I can only speak from my experience, and I really did not enjoy taking that course. But now, the courses we're taking now in clinical medicine are all based on the foundation of all the stuff we learned in pathophysiology in the fall. So we were put through the fire for a reason, but it was not fun getting burned all that time. That's all I'll say about pathophys. Like I said, it seems unimportant, but the details you learn in when you know your pathophysiology, then you know which direction to go with diagnostics, and you know pathophysiology is the bedrock that lets you know how things are supposed to work, what happens when they don't work properly, the different things that happen when they don't work properly, and how your therapies fix them. So pharmacology, if you know your pathophysiology well, you will be able to know exactly how your pharmacology and your mechanisms of action act in the human body through the physiology, if that makes any sense. So it is essential, but it's not fun to learn. And that's all I'm going to say about pathophysiology. Okay, and then clinical medicine, the big doozy, the big one. For clin med, let's see, dermatology. Let me start with dermatology because that was the first thing we had. There were some, for the 8 credit hours, some were heavier and some were lighter. Dermatology and infectious disease were the 2 heavy ones, and then the rest of them were not so heavy. So how we were able to take all these classes is that we would start like derm, maybe, and do derm Mondays and Thursdays or something. Derm was through the entire semester. Infectious disease we would do maybe Tuesdays and I'm just paraphrasing, I can't remember the exact days. But then hematology and oncology, we would start maybe at the beginning of August and finish it by mid-September. And then by mid-September, we would start genetics and then finish that by mid-October. And then by mid-October, we would start radiology and finish that by mid-November. And then mid-November, we'd start, the other. So it was concurrent modules that were starting and finishing at different times. So sometimes you would have a midterm and a final on the same day. And that really confused my friends. And I'd be like, I have a midterm and a final. They're like, it's like October, so what are you? I'm like, don't worry, you won't understand. But anyway, dermatology. Dermatology I enjoyed. The part of dermatology I enjoyed is when you think derm, obviously you think skin. Some people just think Botox and plastic surgery. But dermatology, there are dermatological manifestations of systemic conditions. And it is very, very cool to be able to see these things and know that they are markers of inflammation, and know that you should go digging deeper for some type of autoimmune disease or some type of inflammatory process, and learning how these things work. Again, it goes hand in hand with pathophys. But learning how these things work, I was just like, this is really cool. It's really cool stuff just learning this information. So I like that about dermatology. Knowing the terms was a big deal because then it also helps you with writing your notes. Writing your notes about, a patient has a rash. What's the rash look like? It's red and angry. No, that's not gonna cut it. You can say, it's a maculopapular rash that's centrifugal, or it's blanching, it's verrucous, it's violaceous, it's purulent, pruritic, the lesion below. All of these terms, I enjoyed learning those terms. That's more memorization. But then you look at a rash and you have to describe it, and by that description, you know what kind of illness or lesion or condition you're dealing with. So I enjoyed derm. It was very, very detailed though. Derm is a specialty I have much more respect for now that I've taken that module in clinical medicine. Okay, infectious disease. Infectious disease is where you will learn every bacteria, every virus, every fungus among us, everything that can infect you and kill you. This includes your vaccine preventable stuff, your STDs, your HIV, your gonorrhea, your chlamydia, your tuberculosis, all of these infectious things. You learn about them, you learn how they're spread, you learn where they're endemic to, and then you learn how to treat them. So your pharm and your infectious disease go together, they go hand in hand. It was very detailed. What I liked about our program is at the beginning, they give us the PANS blueprint for infectious disease. This is what you have to know. And then they were like, we're also going to teach you X, Y, and Z because we're in Indiana and you're going to see it. And you have to know what you're looking at when you see it. And because, like measles and coughing spots are always going to be a thing that will be asked about. But in the time that we were taking the course, there was a measles outbreak somewhere. And then there was somebody with mumps, like in Bloomington, in Indiana. So like relevant stuff they would keep us up on. So I really liked the format for it. What I didn't like was knowing exactly how to dose a patient. We'll give them amoxicillin. How many mgs per kg per, I don't like that stuff. I learned it and I did well, but I don't like that stuff. So that's infectious disease, and it was fun because you learned the manifestations. My dog is over here making noise. Well, you learn the manifestations of different diseases and infectious agents, and the latent stages, and when it's, you know, actually where you can pass it, when you're infectious and when you're not. Okay. Then we had genetics. Genetics sucked. I didn't like it. It's sad because I passed, but I think it's just that it was very dense, because the field of genetics in of itself is kind of a marvel, because we're focusing not just on a cell, but on the nucleus, and then the DNA, and then the chromosome, and then the genes, and then the P arms and the Q arms of the gene, and the Robertsonian translocations. It just got very, it got very, very busy very fast, and I was like, what do we need to know clinically? Like, tell me what I need to know about this. Like, all of this theoretical stuff is very annoying to me because I am not a research scientist. But we have to learn it. So I felt bad that I didn't like genetics, because it's really fascinating and knowing what conditions are genetic can be passed on. So they did focus on teaching us the differences in risk of passing a condition on, the ones that are familial, the ones that are autosomal recessive versus dominant, sex-linked, all of those things. And they focused on genetic testing, what needs to be done when people are having children, before they have children, if they know what runs in their family. So I appreciated that, because that's knowledge that you can actually impart to someone else. When you start explaining how the genes do this and that, they don't get it. But when you say you have this chance, you're a carrier, if you guys have a kid, you know, you do your Punnett squares and all that stuff. Explaining that to somebody, and then explaining, we're going to do this test. After that, we'll do this test. We need to do this test at this stage because we'll detect it. At this stage, we won't detect it. All of that stuff. So that part was enjoyable. The rest of it was not. And also, we got to know like how spontaneous genetic damage can occur, and if it's in a somatic part versus a sex organ, and how that can pass on. So there was knowledge imparted in that course, but I didn't enjoy learning the knowledge a lot of the time. Just keeping it real here. Okay, hematology and oncology. So oncology was basically obviously your cancers, and then hematology was your hemostasis, your blood disorders, your clotting disorders. So they combined the both of those. We did them kind of serially and sequentially. And then of course you have your blood cancer. So that was a nice little overlap. We did our leukemias, our lymphomas, our thalassemias. It was mainly overview. They did bring in people that work in cancer to kind of explain things to us more on a this is what we do basis, and this is what we see, and this is more prevalent, and I guess study that, but we've never seen it in our clinic type of thing. So I enjoyed the course, but I understood that it was overview, and you know, just so that we would not be hearing about some of these things for the first time when we go into clinic in that setting. So hematology and oncology I did enjoy, and I did a lot of research on my own after the fact to kind of see how trends are changing, what the number one cancer is, prevalence rates in different races, different socioeconomic groups, risk factors, you know, all of those things, because research is constantly being done in cancer. So I thought I learned a lot more about sickle cell disease than I knew before. You know, I really got enriched a lot by that course with relevant information, so I really enjoyed it. Okay, then we had lab medicine, and lab medicine is exactly like it sounds. We learned about the medicine of laboratory testing, what to order, what to look for, what not to order, you know, what would not be useful to you, how to know if you should, how do I say this, how to see patterns of changes. Hyperkalemia comes from XYZ, hypokalemia comes from XYZ, hyponatremia, hypernatremia, what's a CBC, what's a BUN, all of these things, a panel, liver function test, and I'll, just knowing what all these things are and what can throw off some of your values, so that if you see certain lab values, you're not like, oh, this patient has this one. It's actually like, no, that just happened because of XYZ. So lab med was very direct, it was very straightforward. I enjoyed the class. It told us what to order and what to test. And then we had radiology. That's my zones. For those of you that don't know, I am a radiology tech. I've been a radiologic technologist for 6 years now. So diagnostic X-ray only, and fluoroscopy, and surgical imaging, and some pain management, inpatient, outpatient. So when they were showing us X-rays, because there was a huge emphasis on chest X-rays, as there should be, because it's like the number one thing that people will order for almost anything. A lot of my classmates struggled, they pulled through, but it's like, what am I looking at? How do I know this is this? But I look at X-rays. I've looked at X-rays every day almost for the past like 5-6 years. So I was able to tutor my classmates, and this is what I was talking about in my previous video about everyone having a strength. I knew I had that radiology strength, so I was ready. I had my websites, I had them bookmarked, I put them on our class drive, so everybody had access to them. And I was like, if you have a question about something, text me right away, ask me. And I think everybody did really well in radiology, not because of me, because of their own work, but it was nice to be, a part of their success. I felt like it was a good overview of the different modalities: X-ray, nuclear medicine, MR. I like that they told us like MR is really good for musculoskeletal stuff, but not for the lungs. So don't order an MR of the lungs; it's kind of a waste of time. The different flares in MR, the ultrasound, what ultrasound is good for, what it's not good for. Don't order an ultrasound of bone because a whole lot, that kind of thing. So I liked the way that they structured it. The radiologists that came to talk to us were top notch. I really, really enjoyed their lectures. I learned stuff because I did not go in there thinking, well, I know everything. I wanted to learn, and I learned a heck of a lot. I learned about interventional procedures, musculoskeletal stuff, fractures, infant imaging. I enjoyed that module. I enjoyed taking that module, and I think my program did a really good job of teaching us. It was slide heavy because, imaging, you have to look at images. So there was one PowerPoint that was like almost 200 slides. We were so fatigued that day, but there's no way around it. The only way to get good at recognizing things is to see them over and over and over. And the only way to recognize abnormal things is to know what a normal one looks like over and over. And then when you see an abnormal one, you're like, I don't know what's wrong, but something is not right here. So radiology was a fun module because duh. I had a good time with that. I expanded my my base of knowledge, so that was good. So that was the fall semester. That's what stress. And I know now that I said it, doesn't even sound that bad. But listen, when you sitting in classes after classes after classes, and you'll have an exam, and then you have a class right after, and then another exam. Like, it was so stressful, but we got through it. And I feel the better for it. I'm actually starting to feel like a clinician after that semester was over. Like, I would see drugs on TV and know what they are. I would see certain, like, these stupid TV medical shows you'd see them and be like, no, the patient has blah, blah, blah. I could actually start doing that because of the knowledge that they've been imparting to us. So that was pretty cool. In summary, it was more work than the summer. My social life, in the summer I was still able to do some things. The fall, that was not the case. Had to back out of a lot of things. Had to turn down a lot of shifts. There were some good stretches where I was just wake up, sleep, eat, study, sleep, eat, study, shower, go back, sleep, eat, study. And that was the only way that I could keep up. Like, there was a couple days where I didn't see daylight because by the time I woke up and it's time to go to school, it's still dark. I went in and I study in the same building that we have classes. Some people go out and I just stay in. And by the time it's time to leave, it's dark again. Like, I was not seeing sunlight. I got so pale. I'm still pale, honestly. I'm just waiting for the sun to come out, get me a little darker. But man, you get out what you put in. If you're putting in work and it seems like it's not working, you have to change the format. But that time investment, there is no way around it. There's no way around it. At this point in the fall semester was when I really realized, oh, this is what they talk about with PA school. This is what they mean. Okay, I get it. I get it now. I was still able to maintain, my relationships, but with a lot of, yeah, hey, how you doing? Okay, you do this? Nope, got an exam tomorrow. Nope, got an exam day after that. Nope, got an exam next week. So that's the point where it becomes, like you would study too a lot. You would put in so much work and get like a B, and not even like a real strong, sexy B. You would get like a weak B. And I'm like, dang, I studied my brown behind off for this exam, and this is what I get. I'm like, so if I didn't study, would I have gotten a negative score? I'm trying to understand how this works here. And it's because of the volume of material. And our professors kept telling us, if you feel like you're stupid, don't, because we don't let stupid people in this program. But also, this is the point where you come up for air and you go back down. You swim, and then you come up for air and you go back down. That was how one of the seniors described it. It's absolutely right. You just have to power through, because once you're done, you're done. The sacrifices that you make are only within that little time frame of that semester. So whatever you have to do to get through it, you do it and you get through it. Yes, you can whine, but then you get done with your whining and you face your books. There's 200 slides to look at. We're gonna look at 200 slides. That's what we're gonna do. We're gonna hydrate. We're gonna walk around and stretch our muscles a little bit. We're gonna go right back and sit back down and look at these slides. That's it. You can whine, but then your whining's not, the time you spend whining is time you could spend looking at some slides. So you just have to put your, put the pedal to the metal. Just do it. It's the grind time, prime time. That was really corny, and I'm sorry. Okay. In conclusion, make sure that you manage your time when it starts to get this way in PA school. That's the best thing I see, because the best thing I did wasn't really study. I don't want to say studying more, but it was compartmentalizing my time. If I'm studying today, I'm studying. I'm not going to let myself get distracted by anything. If I am getting distracted, I change my ways, change my environment, whatever I need to do to make sure I focus and finish what I'm doing. If I'm not studying today, I don't even look at my backpack. Compartmentalize your time. Make time for yourself, make time for your family and stuff, but recognize what's important, because you're doing this. The stuff you do in these 2 years, it's what's going to set you up for your future. I'm assuming, unless you just got it like that, but what you're doing in these 2 years is what's going to set you up professionally and just in general for the rest of your life. This is your career. Think of how hard you worked to get to this point. Think of how much work you put in. And all that stuff that you did and you survived it, you can survive this too. It sounds like we're talking about something really abusive here, but you can survive it too. You can survive it. You can do it. Looking forward, we got our clinical rotation assignments in November. Yikes. I'm like, first of all, clinic. So you guys are gonna let me touch actual patients. Wow, that's bold. But the clin med is what you're gonna be applying to your rotations. So we're gonna cover every population you can think of, and then you're gonna be applying that knowledge and your pharmacology and your patient evaluation. All of it, you're gonna put it together and apply it to your clinical rotations. And they did warn us that a lot of things you learn in class are the theoretical things, and then you'll get to clinic and be like, oh, we're gonna give this patient blah blah, and your attending or your preceptor is gonna be like, nobody does that, dude. What are you talking about? Nobody does that. So I'm prepared for that, because that was how it was in X-ray school. Like, I'm gonna turn them 30 degrees with the trochanter. And someone's like, just flip him and take the picture, and can we leave, please? So knowing, theoretical stuff that you need to pass your board exams versus knowing what is practical and applicable and, real world stuff. So that kind of stuff. So clinic is coming. It is January. We'll be in clinic in August. We have some pre-clinic thing that we do in February where we actually go to the hospital as well. So that'll be our first exposure. I'm gonna try to stay focused. This semester seems so easy because we've been abused in the fall. This semester seems so much easier by comparison. But part of it is also, I know I've seen what happens when I don't manage my time well, and I'm not gonna let that happen again. So I've written everything out, I've spaced everything out, I'm managing my time, and it's just okay, we're just gonna move along, we're cruising, But that came from being burned and not managing my time in the fall, and I'm not gonna allow that to happen again. I'm gonna stay focused and remember why I'm here. And most importantly, the thing that helps the most when you're going through all this stuff is keeping an attitude of gratitude. There are tons of people that want to get into PA school. Some of you guys are even watching this right now. They've been trying and they haven't got in yet, and all they want is to get in. And you are in. So suck it up. I had to suck it up when I remember that, it really does invigorate me, and it makes, I look at some of my notes from before I got into PA school, and I'm like, you know what? I asked for this. I'm paying for this, so I'm going to do this. So maintaining an attitude of gratitude and being grateful kind of helps you keep perspective and stay grounded. And also, this is temporary. Your life's not going to be like this, forever. You're going to graduate, and you're going to be in the market, and you'll be terrified. But it won't be like this. It'll be a different kind of terror. All right, so that's it. That's how my fall semester went. Any questions that anyone has, feel free to comment down below, like you guys did before. Thank you so much for watching this video. Like I always say, you can subscribe if you want. Now it really doesn't matter because YouTube has changed their policy. I got this cute little email talking about, oh, you need this many subscribers. I'm like, I'm not gonna get that many subscribers. So a good thing I didn't ask them to subscribe in the first place. Listen, I am making these videos because I hope that they help somebody out, okay? Ain't nobody getting no checks from these. It's just, yeah, so. And I know my style is a bit unorthodox, and the way that I talk and the jokes that I make are a little different, but I hope that they have entertained you. And hopefully also given you some insight into what it's like, on the inside, because people are always like, oh, what's it like? So I hope you've enjoyed this video. Thank you for sticking with me for the past 30-ish minutes. You guys take care. Take care of yourselves, take care of each other, and remain in that attitude of gratitude, I guess. Thanks for watching. I'm going to record another video at some point. The next video I'll make will be, detailing the spring semester and how it's gone, but I also want to record a video about working while in PA school because I'm still employed, believe it or not. I'm still employed. I still work. Yeah. So look out for that video, I guess. I just have to put the content together properly and kind of align it, but yeah. You guys take care, and thanks for watching. Have a great day. Bye.